How to know if you are suffering from chronic phlegm. When you're suffering from chronic phlegm in the back of your throat, you probably don't think about how it got there. You just want it to go away. And for a long time, that's what medical professionals did. They suppressed the symptoms or classified the condition based on its symptoms, making it sound like a disease. But we can approach this from a cause and effect relationship to understand the root cause of the problem. Hey there, welcome back to Mind State. We're here to help you tap into your full potential and become the best version of yourself. In this video, we'll take one symptom, chronic mucus production, and trace it back to its most likely cause. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What causes chronic phlegm? If you've been dealing with chronic phlegm, you're not alone. This uncomfortable symptom can be caused by a number of different factors, including allergies, viral infections in the sinuses, and two conditions known as GERD and LPR. GERD, gastroesophageal reflux disease, and LPR, laryngopharyngeal reflux, are similar conditions that can cause acid to come up higher into your vocal cords and lead to symptoms like excess mucus, throat irritation, and difficulty breathing. These symptoms can be especially problematic at night when the valve at the top of your stomach fails to close properly. While it may be tempting to simply take medication to suppress this symptom of chronic phlegm, it's important to consider the underlying cause in order to effectively address the issue. In the case of GERD or LPR, for example, medication alone may not be enough to fully alleviate symptoms for these conditions and reduce the likelihood of chronic phlegm. A more comprehensive approach may be needed in order to manage these conditions and reduce the likelihood of chronic phlegm. GERD and chronic phlegm. GERD, the notorious gastroesophageal reflux disease that wreaks havoc on so many of us. Have you ever had that unpleasant sensation of acid rising up your chest and into your throat, leaving a sour taste in your mouth? That's just one of the many symptoms of GERD. And let's not forget the belching, regurgitation, excess mucus, throat irritation, a lump in your throat, and difficulty breathing. But what causes GERD in the first place? Well, it all boils down to a malfunctioning valve at the top of your stomach that's supposed to close and prevent the stomach acid from backing up into your esophagus. When this valve doesn't work as it should, the acidic contents of your stomach can make their way up your esophagus, causing that unpleasant burning sensation we know as heartburn. But did you know that postnasal drip and food allergies can also cause GERD? Yes, it's true. When you have excess mucus dripping down the back of your throat, it can irritate the lining of your esophagus, making it more susceptible to acid reflux. Similarly, if you have a food allergy, consuming the offending food can trigger your GERD symptoms. And let's not forget that GERD symptoms tend to be worse at night when you're lying down. Why? Well, it's because the valve at the top of your stomach doesn't close as tightly when you're in a horizontal position, making it easier for stomach acid to make its way into your esophagus. So if you find yourself experiencing any of these symptoms, don't just suffer in silence. Talk to your healthcare provider to discuss your options for managing your GERD and getting back to feeling like yourself again. LPR and chronic phlegm. Laryngopharyngeal reflux, or LPR, also known as silent reflux, is like GERD's pesky cousin. While GERD affects the lower esophagus, LPR affects the upper throat and vocal cords. In LPR, the valve between the esophagus and throat doesn't close properly, allowing stomach acid to flow back up the esophagus, and sometimes even higher up to the larynx, voice box, and pharynx, throat. The symptoms of LPR can be similar to GERD, such as heartburn, belching, and regurgitation, but there are a few key differences. As the acid reaches higher up into the throat and vocal cords, it can cause more irritation, resulting in a metallic taste in the mouth, hoarseness, and a persistent cough. Some people may also experience difficulty swallowing, throat clearing, and the sensation of having a lump in their throat. Like GERD, LPR can also be triggered by certain foods, such as citrus fruits, spicy foods, and tomato-based products, as well as alcohol and caffeine. Lifestyle factors, such as smoking and obesity, can also increase the risk of developing LPR. If you're experiencing symptoms of LPR, it's important to consult with your healthcare provider to determine the underlying cause and develop a treatment plan. In some cases, lifestyle modifications, such as avoiding trigger foods and losing weight, may be enough to alleviate symptoms. Medications, such as proton pump inhibitors, PPIs, and H2 blockers, can also help reduce the amount of acid produced by the stomach. In more severe cases, surgery may be necessary to strengthen the valve and prevent reflux. Pathogen protection. When you think about what you eat, it's easy to forget that your stomach is a very sterile environment. In fact, one of the primary functions of stomach acid is to kill pathogens. Your stomach has a pH between 1 and 3, thanks to the presence of hydrochloric acid. This acidity is an essential barrier for your immune system, as it prevents pathogens from entering your digestive system and causing infections. If you're wondering why this is important, it's because when we eat food, we want our bodies to be able to absorb nutrients like vitamins and minerals from that food. If there are pathogens in our food or drink, they can prevent us from absorbing those nutrients. Protein digestion. The stomach is the first stop on a journey of digestion. It's also the dumping ground for all the things your body can't use or absorb. One of these things is protein. Protein is a vital component of every cell in your body, but it's also difficult for us to break down into its individual components using only our digestive enzymes. That's where hydrochloric acid comes in. Hydrochloric acid helps break down proteins, making them easier for the rest of your digestive tract to absorb and utilize. Without that acid, those proteins might just sit there doing nothing. Or worse, they could do damage to other parts of your body. Mineral absorption. If you're not getting enough hydrochloric acid, you might be lacking in some key minerals. That's because it's not just there to help you digest your food. It's also crucial for the absorption of minerals such as calcium, magnesium, potassium, zinc, and iodine. Without a sufficiently low pH, these minerals cannot travel into your body efficiently. This can lead to mineral deficiencies, including anemia and other health problems. Acid reflux and mucus production. In the world of digestion, it's all about the flow. If you have too much going on in your stomach, you may experience heartburn and acid reflux. On the other hand, if you don't have enough hydrochloric acid in your stomach, you may experience acid reflux and mucus production, which can cause irritation and discomfort. This is because the valve between your stomach and esophagus may not close tightly when it should, allowing acid and bile to regurgitate into your throat. This irritation leads to the production of mucus, which aims to protect against the acid further irritating the throat. Chronic phlegm is a common problem, and suppressing the symptom is not the best solution. To understand the root cause of chronic phlegm, we need to look for a cause and effect relationship. The likely causes of chronic phlegm are allergy, virus and sinuses, GERD, and LPR. Identifying the underlying cause and treating it will provide long-term relief from chronic phlegm. As you can see, hydrochloric acid in your stomach plays a crucial role in your overall health and well-being. If you suspect that you have low stomach acid levels, it's important to speak to your doctor to determine the cause and explore appropriate treatment options. By supporting your digestive system with sufficient hydrochloric acid, you can help prevent a range of health problems and maintain optimal health. Thanks for watching, Mind State fam. If you've found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.